Hello, everybody. Welcome to the virtual college exploration for all Pennsylvania students. My name is Laurie Barrow. I'm from Harrisburg University of Science and Technology. This event is sponsored by PACAC, which is the Pennsylvania Association for College Admission Counseling, and StriveScan. PACAC is a nonprofit association comprised of more than 1,200 school counselors, college admissions counselors, independent education consultants, and other professionals responsible for guiding students through the important transition from high school to post-secondary options. Thank you all for joining us. Just a few housekeeping announcements before we get started. You can use the Q&A button on your screen to type your questions to our presenters at any time. Your camera and microphone are off, so the panelists cannot see or hear you. This is just one of many different sessions happening, so be sure to check out all the other sessions available to you at pacac.org, pacac.org. This presentation is being recorded and will be available within about a week at the same website at pacac.org. I'd like now to turn it over to our presenters. So welcome Wilkes College, here to talk about their nursing program. Sorry, 1 second here, Tita. You guys have the screen? Great.
There we go, unmute myself. Hi, everybody. How's everyone doing? We're really happy to have you guys all here today to learn about the inside scoop to becoming a nurse. So today we'll be presenting from Wilkes University, Wilson College, and York College. So I'm representing Wilkes. My name is Liz, and I'm an admissions counselor. So we're going to start off first. Let's see if I can get, there we go. So this is our campus, but the first person we are going to bring to the floor is going to be Kelly Birch, our student from Wilkes University, who is currently a nursing student, who's just going to give us a brief overview of why she chose Wilkes and some information about the nursing program here. So Kelly, if you want to take it away for us.
Okay, can you guys hear me?
Yep, you're good.
Okay. Hi guys, so my name is Kelly Birch. I'm a sophomore nursing major here at Wilkes University. I'm actually from New Jersey, so I'm about 2 hours away. The reason why I chose Wilkes was because it is a small campus. You have like a one-on-one experience with your professors. They get to know your name. They get to know who you are. I'm also actually a part of the Air Force ROTC program, so that was also a part of my search for when looking to for colleges. So Wilkes had both here for me. So far, I've had an amazing experience with nursing. I haven't started clinicals yet. I actually start next spring, hopefully if COVID cases stay low and we are still on campus. So if you have any more questions, hopefully I'd be able to answer them.
Great, Kelly. Thank you so much. So we will have a questions answer for at the end of our presentation. Our next presenter from Wilkes University is going to be Dr. Laura Chavez, who is an assistant professor here at Wilkes University. So take it away.
Hi, everyone. Thanks so much for watching and listening to us today. Like Kelly said, my name is Dr. Chavez. I've been at Wilkes for a couple years now, and I just want to tell you a little bit about our program. One of the things I really like about our program and that really drew me in as an educator was that we get to start clinical early. We start doing clinical in your sophomore year. So like Kelly said, next semester she's going to really get into the clinical aspect of things and really get hands-on. And one nice thing we do with clinical is it's not just focusing on the hospital. It's not just focusing on acute care. We give you experiences in lots of other areas. Outpatient settings, home health care, within the population, within the community. We do flu shot clinics with the city of Wilkes-Barre. We partner with some doctor's offices to do pediatric clinics. We send students down to Geisinger Danville to their clinical in the psychiatric hospital and in their giant pediatric hospitals. We get you some really great clinical experiences. And clinical, like I said, it's not just focusing on being in the hospital. We also do a lot of really great work with simulation. Every clinical course that you're going to be in has a simulation component to it. So you get to work with the high fidelity mannequins, you get to work with our standard patients and actually have someone speaking to you in a bed and live and interacting with you, which is really nice and really great. So not only do you have like these clinical experiences and these simulation experiences, but we also do a lot of interprofessional education. And with a lot of the local schools around here, we partner with pharmacy schools, we partner with the local medical college, and we partner with social work as well. And every year, every semester actually, starting your junior and senior year, you get to work on these interprofessional education experiences with lots of other schools. And we try to keep you in the same group. So you're actually forming relationships with these different students. So those are two really great aspects about the clinical that I love at Wilkes. Another really nice thing that we do is we let you get involved with research really early. You'll take a research course your junior year, and after that, you can start working with faculty on different research programs. I have personally already worked with 3 or 4 students, I don't remember off the top of my head, doing different research projects. And one of our research projects from last year got published last week, actually. And next fall, we're accepted to go present at a conference. So that student, she graduated this past year. She was one of our seniors last year. She now has a publication under her belt, and she has a presentation to look forward to next year. So we do have a lot of really great and different things that we do at Wilkes University. And if you have any questions, I'm more than happy to answer all of them.
Well, thank you very much, Dr. Chavez. We appreciate that. And Kelly. So I'm just going to go over some basic information about our application here at Wilkes. So our application process is super simple. We take the Wilkes University application or the Common App. So you can choose to apply through either of those. We don't prefer one or the other, but we definitely take both. One thing that is definitely important to note is to use our application fee waiver if you are applying for fall 2021. It is admissions, so you can use that and it'll waive the fee for that application as well. Another exciting thing as well is that Wilkes University has gone test optional for fall 2021. So the only thing we really require are your official high school transcripts throughout your high school career. You can choose to submit SAT scores or ACT scores if you would like. We will review over everything no matter what and what you send us. So we do have an early decision process here at Wilkes. So if you apply by November 15th, you will guarantee to hear back from us from December 1st. Also guaranteed to get some FAFSA information back from us as well earlier. So that's the most important date for November 15th. If you want to choose rolling admissions, we also have a rolling admissions process so that we will take applications on a rolling admissions basis. Now, if you have questions about specific, anything else about the nursing program, you can definitely reach out to me. I'll go back to our slide real quick about all our contact info. Another really important thing too is that we are actually open for visits and having a small in-person open house too. So if you're interested in visiting campus and learning a little bit more about our programs, getting a tour of campus, we would love to have you come and visit campus and see everything. So I believe that is all I have right now. So we're going to hand it over to Vanessa at Wilson College.
Hi, everyone. My name is Vanessa Whitfield. I'm the Assistant Director of Admissions here at Wilson College. We're just going to follow the same format as the previous school. So our first speaker is going to be Ophelia Mcdonald. She's a junior nursing student. You can hit the next slide. Feel free to take over.
Okay, hi, everyone. Wait, can you hear me? Yeah, okay, nice. So my name's Ophelia, like Vanessa said. And I'm in the nursing program my junior year. And one of the things that really stood out to me about Wilson was being from New York, you can really get lost in like the big populations of other schools. So what I really liked was that from the beginning, I wasn't just a number or just another student. I was like, I had a name, like everybody knew my face and my name, which I really liked. And another thing that really stood out to me about Wilson was that I got accepted right into the program, like my freshman year. So I didn't have to wait 2 years or 3 years to really like get into my clinical work. So from my freshman year, I've been doing clinicals, whether it was in the Nursing Resource Center or in actual like hospital environments, which is another thing that I really like. So even now, being remote, the professors really put a lot into their work, making sure that they know that we're really understanding even from being far away. Yeah. So,
You're, okay, thank you.
okay, sorry.
And next we're gonna have Dr. Julie Beck present. She's our director of the nursing program as well as health sciences.
Hello, everybody, and thank you for attending. I'm really excited to be here and tell you a little bit about our program. I love hearing about the other programs and what they're doing and how innovative they are. So this is really exciting for me as well. For our nursing program, I've been here at Wilson since 2016, and I'm now the director of program and health science. We have 100% job placement for all of our graduates. We actually do clinical all 8 semesters here. We start you in nursing clinicals your very first semester. And as Olivia said, she started her freshman year, her first semester, which is really exciting for us. And I think it's really helpful for students to kind of discern whether or not nursing is for them or not. And that's really exciting for us to see those light bulb moments even early on. We do also have a great simulation lab. We have about 10 mid-fidelity avatars, and we've got 2 really high fidelities where we have a mannequin that can birth a baby. Not my cup of tea, but nevertheless, we can do that here on campus. And so that's really exciting. And during these COVID times, we've been doing a lot of critical thinking. And I don't know if any of you are aware that the next generation of our NCLEX is really focusing on clinical judgment, prioritization, delegation, leadership. And that's really what our clinicals have been striving to pull together information from the past semesters and making those decisions open for the students to make those choices, which is really exciting to see. So we're being very proactive. We utilize area hospitals as well as outpatient facilities and nursing homes. We have a footprint that goes anywhere from Fulton County to the west of us, over to York Hospital in York, Memorial Hospital, UPMC, as far north as Geisinger, and as far east, York, but also Hershey Medical Center, which is really exciting for those folks who want to do pediatrics and working at their pediatric hospital. So it's kind of nice to be able to have that variety for the students to be utilizing. We are very student focused. I think that's been brought up before with both Wilkes and Wilson. We also offer a medical Spanish mission trip, which is kind of unique in nursing. And I was fortunate enough to go in with that in January, and that was just absolutely phenomenal, where we provided healthcare, medication teaching, medications for the Bates down in the Dominican Republic. Not to mention that it was absolutely beautiful in January. We also have a single parent program here at Wilson College, which is rather unique. I don't know about any other schools in Pennsylvania that offer that. And that was one of the reasons that attracted me to Wilson College. And another one of our focuses as we move forward, we're looking at holistic healthcare as well as a focus on mental health and mental health in the community. We do a lot of innovative things with the community. We have a collaborative simulation day where we work collaboratively with our fellow peers at Penn State Mont Alto and Franklin County Career and Technical Center. And we do a lot of innovative things with that. And we are looking to do more work with area nurses as far as our research goes, and working collaboratively. We have a research day, and we do a lot of evidence-based practice research here at the college. So that's my little elevator speech. I'm really excited to be here and really excited that you're here with us. So thank you.
You can hit the next slide from, thank you, boom. Okay, so we do have our own application. We also have the Common App. It's free to apply, no application fee for us. August 1st, well, in the summer is when we open our applications up. We're rolling admissions, and just like everyone else, our national deadline is May 1st. But, you know, if it happens to happen after May 1st, that's okay. But we try to stay to May 1st. Our nursing program does have certain requirements. We want you to try to have a 3.0 GPA. We do have 1,000 SAT requirement, as well as 21 composite for the ACT. And then we also want your science classes to average out to a B. But the only required documents would be your transcript and then your SATs or ACTs. I've been at Wilson for a long time. I don't want to say how long, let's just say double-digit years, because my mother went to school here. She was actually a part of the single parent program. And I ended up coming to Wilson as well. I graduated in 2014, but our school is pretty small, but I personally like that because of the small class sizes and the fact that the professors get to know you. It's kind of a genuine connection. And I was an athlete, so it was always cool to see my professors supporting me in the bleachers and stuff too. So nice, well-knit community. And if you're a fan of Harry Potter, the campus itself looks like Hogwarts. So that's definitely pretty cool too. So thank you for joining us. If you have any questions, there will be time for you to ask at the end.
All right, and now we are at York College. So Molly, hit it.
Okay, hi everyone. My name is Molly Corey. I work at York College, Pennsylvania in the admissions office. Before we get started, just so you kind of have an idea of who I am. So I work with a few counties within Pennsylvania. So if you are in central PA, I'll be the one reading your application. But I also am a graduate of York. I graduated back in 2012. So just a fun fact, but we will move right along and we will have Allison Hale. She is our current York College nursing student. We will have her start chatting. So go for it, Allison.
Alrighty, so my name is Allison Hale, guys. I am a senior nursing major at York College. I also am an admissions tour guide, so if you ever come to York for a tour, you might see me. As I said, I am a senior, so I graduate in May, so I'm really excited to be, 90-ish% way through the program. Something that really made me excited about York when I was looking at colleges is that we are a direct admittance into our nursing program. So we're not a 2-in-2 program where you would be pre-nursing for 2 years and then apply into the program. It really was something that made me excited about coming to York, to know that as soon as I come to the program, I am part of the nursing program and know that I am accepted in as long as I maintain the right GPAs and things like that. I have really enjoyed our clinical experiences so far. So we, like some of the other schools that I've mentioned, start our clinicals in our sophomore year. So you get to get your foot in the door pretty quickly, which is really exciting. So I've gotten to have some fun experiences on med-surg floors, OB and peds. I'm in psych right now, which is a whole nother level of interesting. But so we get a really well-rounded experience. I actually just applied for my practicum, so hopefully I'm going to be in an ER next semester as I finish out my time at York. So that's a really exciting thing, is that we do have a lot of clinical options throughout a lot of hospitals in the area. Something that is also really nice is we have really small class sizes. So our faculty to student ratio at York is 15-1. So you're not just a number to your professors. They know you by name. Half of my professors know who my nephews are because they see them on campus with me all the time, running around, things like that. So it's really cool to have that one-on-one connection with your professors. I'm on first name basis with a lot of my professors, and they've been awesome with helping me with career options and things like that. Another thing that's really nice about York is we are an accredited nursing program. So after I did my first clinical rotation, I was actually able to get my CNA license because I'm from Maryland, so we need a license. And so I've gotten to work in a hospital my last 2 summers, which that hospital now has already offered me a job for when I graduate in May. So it's been a really good career development steps as well, that I know that when I graduate in May, I already have a job lined up and I'm going to get to take the next steps in my nursing career. So that's really awesome. But yeah, if you guys have questions, feel free to throw them in the chat and we'll answer them in a bit.
Okay, thank you, Allison. And then, oh, Liz, if you want to hit the next slide. And then Dr. Pacino, if you are ready, you can start talking more about our program.
Hello, thank you for coming, everyone. Allison, that was just a wonderful introduction. You stole a lot of my thunder. But seriously, a little fun fact, Molly, I actually graduated from York College as well with a bachelor's and a master's degree from here. I graduated with my bachelor's in nursing and got out into the real world and realized very quickly that I had a pretty high quality education. And when I wanted to go back for my master's degree, I came back to York College, and you know, one thing led to another, and here I am working full time. So to tell you a little bit about our program, as Allison mentioned, we are a direct admit program, meaning if you are accepted as a nursing major, you do have a clinical spot when it comes time for you to enter clinical. So that's usually a plus for students that are looking for different programs. And another piece with our program, Allison mentioned that, you know, we have a one-on-one basis, or, you know, our faculty know our students, you know, by name. You also have an academic advisor who is a faculty member in nursing. So whoever your academic advisor ends up being, it will be a full-time faculty member that leads you through the process from your first semester through your final semester. We do have 5 semesters of clinical experiences, and like Wilkes and Wilson, we have a wide variety of clinical experiences, anywhere from inpatient hospital experiences to a wide variety of outpatient experiences as well. Our major hospital systems that we use are UPMC Pinnacle. We also have Hershey Medical Center. We have a number of rotations there actually now, Wellspan and Geisinger. So we have quite a few opportunities for clinical placement. We do graduate 2 classes every academic year, meaning we have a December graduating class and a spring graduating class. So if something should happen and you become ill, or a family member becomes ill and you need to step out for a semester, you do have the opportunity to come back in and pick up where you left off, rather than waiting a year to get back into your clinical rotations. So that has been a plus for us over the years. We have students that graduate from our program and they go all over the country. We have students in many different states after they graduate. So whenever you're, you know, ready to think about where you want to work when you graduate, pretty much any state in the union, you can go and work most likely. So our pass rate is very good. It's between 90 and 94% over the last 3 years. So we're very proud of that. Something that I'm kind of passionate about right now is we have recently gone through an evaluation process of our curriculum, and all nursing programs do that from time to time. It's just part of the process of being a nursing program and offering an education for our students. But we did recently go through an evaluation process and have made some pretty awesome changes. Unfortunately, Allison's going to graduate before that comes to fruition. But we have added a Surg course to our curriculum, and we have rearranged a couple of things so that we have just a better curriculum, we think, for our students that are coming in. So we're very excited about that. And as we have done those changes with our curriculum, we are thinking about the next generation NCLEX, which Dr. Beck mentioned a little bit ago. So we are in the process, as we change our curriculum, we are changing to address the upcoming changes on the licensing exam that any incoming student will be seeing here over the next few years. So those are the major highlights. As everybody has already said, we are happy to answer any questions for you. We're very excited that you're here and hope that you learned a little bit of something about nursing and nursing education. And we look forward to hopefully working with you in the future. Thanks.
Awesome. Thanks, Dr. Pacino. Liz, can you click the next slide, please? Okay, so to wrap up this segment, and then we will get to some questions. I see we already have one, which is great. But if you have any interest in York College and you would like to apply, for any seniors right now, our application is available. It is completely free. You can apply on our website or you can apply on the Common App. It does not matter to us. If there are any juniors or sophomores, our application is normally available July 1st every year. So your senior year, July 1st. This year, like many colleges, we have officially become test optional. So it is entirely up to you. If you would like to provide SAT or ACT scores, you can. If you don't want to, or you took the score and maybe you don't like it, you can always apply test optional. If you provide test scores, all we need is your application, your high school transcript, and the test score. Pretty simple. If you decide to apply test optional, as you can see, there are a variety of requirements. We do need your transcript, which we would like to have your senior year classes listed. We need 2 letters of recommendation, especially for nursing. We'd like to have a recommendation be from a junior or senior year teacher in a math or science class. We also would like a recommendation from your guidance counselor, and then a personal essay. You can write about anything. We do have prompts on our application, but if there's something you're passionate about that you'd like to talk about, you can write that for your essay. It's not listed, but we are offering visits right now. It is definitely a modified tour. It's mostly an outdoor walking tour, just for the safety of our students. We're not really going in a lot of buildings, but if you'd like to just step foot on campus and take a tour, we would love to have you. You are required to wear a face mask, please. And they are smaller tours. We have about 12 people per tour. So if you have interest, we'd love to have you come to campus. Ta-da! So with that being said, if you guys have any questions, please feel free to put them in the question and answer. We have plenty of time to answer those questions.
So we do have a very great question that is directed to any faculty. So it says, could one of the professors outline the difference between various nursing degrees, RN, LPN, CNA, BSN, and then highlight the value of getting a BSN in terms of job opportunities, compensation, and further education? So very thorough question. If someone wants to take it away, or multiple people want to answer, and then we'll go from there, all right?
I can start chiming in, and I'm certain my colleagues will be happy to add. But the difference between RN, LPN, CNA, BSN. So RN stands for registered nurse, LPN stands for licensed practical nurse, and CNA stands for certified nursing assistant. Certified nursing assistants are not nurses. They are not licensed to practice nursing. So they are generally care providers. And so their pay scale is going to be less than an LPN or an RN. And an LPN is a nurse. They are licensed as a nurse, but their scope of practice isn't as broad as a registered nurse's scope of practice. And so again, their role is going to be a little bit different, and the pay scale will be lower. A registered nurse is what our 3 programs are talking about this morning, or this afternoon, excuse me. And we offer bachelor's degrees, and we do in general encourage people to consider a bachelor's degree in nursing before you obtain your license as a registered nurse, because as you get out into the workforce, most places are requiring that within a certain time frame you obtain your bachelor's degree, because evidence demonstrates that patient outcomes are better when you receive care from a bachelor's prepared nurse over the course of time. And so rather than getting an associate's degree and then going back for your bachelor's degree, why not just go straight through and get your bachelor's degree straight off? So my colleagues, do you have anything else to add to that?
I just wanted to wait until you were done, Carrie. I had put something on the chat that kind of outlined the difference between diploma, associate's degree, bachelor's degree. I'm not sure if it came across or not.
Yeah.
Okay, so just to kind of outline that a little bit, and to kind of dovetail into what Carrie was saying, that a lot of hospitals now, as we're looking to improve patient satisfaction and to improve the healthcare experience for our more acutely ill patients, hospitals are looking to hire bachelor's prepared nurses, primarily in their settings. And really it is lots of evidence-based practice out there that talks about the safety that's associated with a bachelor's prepared nurse, a more well-rounded experience with a bachelor's prepared nurse, and a more critically prepared nurse at the bachelor's degree. But there are 3 levels of entry for an RN, as what Carrie had talked about. Laura?
I just wanted to add in that many of our students are interested in going beyond the role of the registered nurse, so looking to become nurse practitioners or CRNAs and work, in the field of anesthesia. And you do need that bachelor's degree in order to go on to get the master's degree or further to the DNP or a PhD.
Awesome. Thank you, everybody. And I think we have one more question for York. Are you a 4-year or a 2-year school?
We are a 4-year school. 4-year programs, mostly undergraduate. We have definitely a growing list of master's programs. We have quite a few within the nursing field, but we also have a lot growing within like public policy as well as our business area. But yeah, your college is a 4-year institution. Yes.
So anybody, please feel free to ask any questions. We'd love to hear from you. I don't think we have any questions right now. But one thing that I want to touch on and that I missed when I was talking to is that Molly kind of put it in my head too. That we are also a direct admit program to Wilkes. So I know that's kind of increasingly more popular because some schools don't do that. So we are also a direct admit. So I don't know, Vanessa, if you want to speak about that too. So just to kind of know we're all on the same kind of level there.
Yeah, Ophelia kind of mentioned that when she first started speaking. We are also a direct admit program, and students' eyes usually light up whenever I tell them that news. I also did forget to mention, Molly made me think of this as well. You can also come and visit us in person, and we're also having open houses, but of course, we want you to mask it up, and we are following safety protocols along with that.
Does anybody want to add anything that they have about any nursing programs or anything they thought they missed? We don't have any questions right now.
If I could, I just wanted to mention that, so last semester when COVID hit, it turned everything upside down. And we did go off campus for the end of last semester, but we are back on campus now. And we are back in the swing of things with clinical as well. None of our students take care of COVID-19 patients, but we're still in the hospitals and we are still able to get a lot of good experiences in. Some of our specialties, we can't really be in hospital at the moment. So we're doing a lot of the virtual simulations and time in our CNSC, which is our nursing lab. And so we're giving students still a good hands-on experience, and doing these virtual simulations, we can match them up to exactly to what you're learning in class that week. So it really kind of drives those points home a little bit better.
Awesome. All right. Perfect. So we do have a question. So this is going to apply to probably Molly and myself. When applying to a test optional school, do you advise submitting test scores, and is there a benefit to doing so? And if you do advise this, what type of scores do you look for? So I'll go quickly first. So it's an interesting year because we have gone test optional. So if you have taken your SATs and you have done very well on them, yes, I would recommend submitting them. But if you do score lower and you were hoping to take them again and you don't have that opportunity to take them again, that would be the chance to maybe not submit them and choose to apply test optional. For Wilkes, we usually look around, I believe, a 1050 for the nursing program. So that's a super score. So what I would say is that if you took the SATs and you're not sure of what to do, everybody in the state of Pennsylvania will have a admissions counselor from Wilkes University where they can reach out to us and say, hey, I got this on my SAT. This is where my GPA is. What do you think would be the best option for you? I work with a lot of students in York County, Lancaster, Berks County. So I would advise you to reach out to your admissions counselor first, just to see what maybe the best option would be for you. Because I know a lot of students I've been working with, they only got to take it once and they keep getting canceled and canceled and canceled. So they didn't do as well as they wanted to do on that first chance. And some students do happen to take them 3 or 4 times in the past, we know. So what I would say is I'd advise you to definitely talk to an admissions counselor at Wilkes. I will go over whatever scores you have, what your GPA is, and then we'll go from there, okay?
As far as York College, we have very specific requirements if you provide a test score. Test score wise, we require an 1100 on your SAT. If you take the ACT, it's a 22 composite score. So if you don't meet that 1100, I would go test optional. If you have over an 1100, awesome, submit it. It's easy. You can do that. We do have a very specific GPA requirement, which is a 3.4. And that's whether you provide test scores or if you apply test optional. If you maybe have a 3.2 and you're like, oh no, what do I do? Have no fear, you definitely apply as test optional. Anyone who falls between, I believe it's a 3.25 and a 3.4, it will go through our director's review and we'll see what classes you take. That's where a letter of recommendation from your math or science teacher really comes into play. If you fall below that 3.2, that's okay, we'll still look at it. And if we need to send it over to the nursing department for a final review, we will do that as well. So there's definitely a lot, I don't want to say wiggle room, but there's more options when you become test optional. But if you have the test score and you have that 1100, you're more than welcome to submit that.
Yeah, I agree with Molly. If you have those test scores and they are around above, I would recommend submitting those. But definitely I'd say reach out to the admissions counselor. We're going to be the ones that can to help you out and kind of decide from there.
Mm-hmm.
All right. Next question is, we sometimes have students that attend community college first. How does that typically impact a student coming to one of your schools and wanting to be a student in a nursing program? Can they transfer into the program? So I don't know if a faculty, is there anybody that's faculty that wants to take it, or should we admissions would like to take that? Is anybody?
I can address what we do here at Wilson.
Okay.
And Vanessa, you can correct me if I'm wrong, but we have agreements with several of our community colleges. So we have an agreement with HAC as well as Hagerstown Community College, in that students are allowed to take those courses at HAC or Hagerstown, and it's a very smooth transition, smooth transfer into Wilson's nursing program. You know, you have to have a C or better in those classes for us to count that. They count it towards your liberal studies or electives or whatever. And as an advisor, we then adjust your plan of study that, you know, it would be less credits that you have to take here at Wilson, and that we can adapt your plan of study accounting for those courses that you took elsewhere. I hope that answers that question.
York College is similar in that we do accept transfer students. We also have a dual enrollment agreement with HAC. It's the closest community college to our campus. And we also do take students from other institutions that, you know, we do every year. Typically we'll get a few students that went away to college and then they realized maybe living 6 hours from home really wasn't the best idea for me. And then they want to come to a college that's a little closer to home. So we do get students like that every year. We do have a transfer advisor solely dedicated to advising students who are coming from another institution, making sure that everything that they've taken is going to transfer and that they're meeting the graduation criteria, and they're not, you know, behind, or, you know, just knowing what their transfer credits look like and how that's going to look at your college. But we do accept most credits from most institutions. So that's definitely an option for students.
At Wilkes University as well, we do accept transfer students all the time. We don't have any agreements with any community colleges, but you just need to, as long as you achieve the minimum requirements for science classes and things along those lines, absolutely your credits will transfer in. And we do have, like I said, many students that do transfer in because they decided that they didn't want to be so far away from home or various reasons. We also get a lot of students in our accelerated program where maybe they got 2 or 3 years into college and realized they didn't like their major and they didn't want to follow that major anymore. And it was actually a faster route for them to graduate within their major. And then they applied to our one-year accelerated nursing program. So if you already have a bachelor's degree in anything, you can apply to our accelerated program and finish with your degree in nursing in 1 year.
Awesome. So we don't have any more questions. I believe we only have about 5 more minutes left, but thank you everybody so far for your questions. So again, 5 more minutes if anybody wants to put any more questions in. If not, we can always get to them at a later time. But we're really happy that everybody came today, and we thank everybody for showing up, our presenters and everyone that came and asked questions. So hopefully if you have any more questions about our schools, you can reach out to us, fill out some applications, come visit. I always recommend students to try and come visit any campus that they might be interested in, even if it is a modified tour. It's a really great opportunity to see what each campus has for you and how you feel on campus too. So I don't see any more questions. Anybody else need to add anything today?
I don't think so.
Just thank you for the opportunity. This was great to hear from everybody and nice to see folks, and everybody who's out there. We can't see you, but thank you for attending.
Oh, there goes our thank you for joining us. But yeah, thank you everybody again.
I want to thank all of you for being here today. Thank you for everyone in the audience and for all your questions. When you close this window, there will be a link to a very quick 4-question survey. We'd appreciate any feedback you can provide. Also, this was just one of many sessions being hosted, as I mentioned in the beginning. So be sure to sign up for additional sessions at pacac.org. That's PACAC.org. And in about a week, you'll be able to find this session's recording, as well as all the other session recordings at pacac.org. Thank you very much and have a wonderful day.